Each year, over 750,000 children visit the emergency room with traumatic brain injuries, including concussions. One recently published survey looking at more than 13,000 adolescents in the United States found that almost 1/5 reported having had at least one concussion. Moreover, if a child has had one concussion, they are 3 to 5 times more likely to sustain another. Girls are 1.5 times more likely to get a concussion than boys, and an 18-year-old's concussion risk is nearly 2 times higher than that of a 13-year-old's. So what exactly are concussions, and what does it mean when a student has one? How dangerous are concussions to a student's long-term health? The answer is as complex as the brain itself and requires an understanding of how the brain responds to injury, awareness of the subtleties of signs and symptoms, and careful acquaintance with appropriate treatment plans and school accommodations. A concussion is a type of traumatic brain injury, or TBI, that happens when there is a bump, blow, or jolt to the head or body that causes the brain, which is made of soft, fatty tissue and has the consistency of jello, to ricochet around inside the hard shell of the skull, resulting in damage to the spindly network of over 90 billion neurons that are responsible for communicating within the brain and controlling our bodies. On impact, these neurons are stretched and can even tear, disrupting their ability to transmit communication and releasing toxins that destroy other neurons too. This is a concussion and can present in many different ways, including physical symptoms like headache, dizziness, nausea, and sensitivity to light and noise. Cognitive symptoms including feeling foggy or confused, difficulty concentrating and loss of memory. Sleep symptoms such as loss of sleep, difficulty sleeping, or significant change in sleeping pattern. And emotional symptoms like anxiety, panic attacks, or depression. Just like every brain is different, every concussion presents with different symptoms, and the recovery experience is varied. The vast majority of concussions completely heal within just a few days to weeks when, given adequate rest and a gradual return to physical activity, the brain is able to heal itself. Prolonged recoveries occur when the brain isn't allowed the rest it needs, or when there is a premature return to sports or trying to play through a concussion. This also increases the risk for post-concussion syndrome, when concussion-like symptoms persist for months, often causing social and emotional withdrawal. It is important to note that post-concussion syndrome is not the same as the more widely known CTE, or chronic traumatic encephalopathy. CTE is a progressive degenerative disease of the brain, typically caused by multiple head impacts, with symptoms usually occurring many years after the original injury or injuries. Post-concussion syndrome, on the other hand, is when symptoms with immediate onset after head trauma, anywhere from minutes to a few days, persist longer than expected, but with time and treatment, eventually fully resolve. Recognizing a possible concussion is important in the school setting because in the young, developing brain, concussion effects can be more serious. Who should be evaluated for concussion? The answer is any student who suffers a blow or hit to the head while at school should be evaluated by the school nurse. This can sometimes be confusing to teachers of young children who may often bump their heads. A good rule of thumb is any student complaining of pain, feeling or acting unwell after hitting their head, or any student that hits their head hard enough to provoke the teacher to ask, "Are you okay?" should be sent to the school nurse for further evaluation. A concussion can occur from seemingly minor incidents, so it is better to err on the side of caution when assessing head injuries at school. Kids may also suffer head injuries outside of school and come to school complaining of symptoms, making the ability to recognize possible symptoms of concussion and appropriately refer to the school nurse or health office, a critical skill for school staff. When evaluating a head injury, it is important to obtain details on the mechanism of injury and observe for and ask about any concussion symptoms. Does the student appear confused, respond slowly to questions, or answer incorrectly? Do they show signs of memory loss or behavior change? Do they report feeling dizzy, having a headache, vision changes, nausea, or sensitivity to light? History of previous concussion is also relevant, as a student with a previously diagnosed concussion is more likely to sustain another. If signs of a more serious brain injury occur, like severe headache, repeated vomiting, slurred speech, convulsions or seizures, unusual behavior, or a loss of consciousness, emergency medical services should be activated. If a concussion is suspected, parents and guardians should be notified, and the student should receive further evaluation by a concussion specialist before returning to school or physical activity. It can be helpful for schools to provide a concussion accommodations checklist for healthcare providers to easily convey how the school can best support the student through their concussion recovery. Accommodations range from increased time for homework, wearing sunglasses at school, and taking frequent breaks, to limiting screen time, providing pre-printed notes, and avoiding crowded and noisy hallways. School nurses, teachers, counselors, and other school professionals, together with the student's family and healthcare provider, should collaborate closely to develop a school plan and ensure support is in place throughout the school day. Anytime an activity or task worsens a student's symptoms, they should stop, and accommodations may need to be modified. The goal is to gradually increase the duration and capacity of schoolwork and activities without exacerbating symptoms. Return to physical activity or athletics following a concussion should be directed by a licensed and qualified healthcare provider. A gradual, supervised return over several days or weeks is best practice and, when possible, should be overseen by the school's athletic trainer. If available, student athletes should complete a preseason baseline concussion assessment that can be used to help evaluate for a possible concussion later in the season. Concussions are typically diagnosed by a licensed healthcare provider based on the report of injury, physical assessment, and symptoms the patient reports. Contrary to popular belief, imaging is not usually used to diagnose a concussion, but in some cases of severe symptoms, it may be used to rule out a more serious injury or concern. Because of the subjective nature of concussion symptoms and the need for a return to school and activity plan from a healthcare provider, documentation by the school is imperative, and frequent follow-ups by the school nurse and other support staff are necessary. Concussion recovery can be frustrating and isolating. Kids can feel not like themselves, left out of athletic competitions or other activities, or like they are falling behind in academics. Encourage them to spend time with friends and teammates whenever possible, and if necessary and available, school counseling staff should provide emotional support and care to students recovering from a concussion. If, following a hit to the head, a student is assessed and there is no evidence of or suspicion of concussion, the student should be monitored for at least 30 minutes and can return to school, but should avoid athletics, PE, and other physical activities for the rest of the day. The school nurse should check in on the student throughout the day, and parents or guardians always notified and provided concussion education and instructions for symptoms to monitor for and when to seek further care. Symptoms of a concussion can, at times, appear several hours or even days after an initial hit to the head, so communication and follow-up checks are of critical importance. Planning and preparation are fundamental to keeping students' brains safe. School nurses should work closely with school or district administration on implementing evidence-based concussion policies and establishing a concussion action plan for school staff, including coaches, to refer and adhere to throughout the school year. Teachers, coaches, parents, and students themselves should receive concussion education at least annually or as required by specific states or districts, cultivating a school culture of concussion awareness and support. Maintaining a safe, physical school environment, including decluttering of hallways and stairwells, proper maintenance of play areas and surfaces, advocating for safe athletics policies, and ensuring appropriate supervision at all times can help reduce the likelihood of a student suffering a head injury at school. Successful concussion prevention and management in the school setting requires critical leadership from the school nurse and informed partnership from other school professionals, as well as families and students. So make sure you are knowledgeable on concussions and associated signs and symptoms, can recognize and identify suspected concussions, have a concussion policy and action plan in place, and ensure all necessary school staff are appropriately trained. advocate for and institute a concussion support team to care for and provide healthcare provider recommended accommodations for the student at school. Consider the student's physical and emotional health in the concussion recovery process, and maintain physically safe school environments. Schools have the responsibility to keep kids as healthy and as safe as possible, and this includes protecting their still young and developing brains. Efficient and effective concussion awareness, education, prevention, and management in the school setting help to grow and maintain healthy brains for bright futures. This video was brought to you by your friends at McGill. If this information was helpful, and you're interested in other videos that can help promote health and safety in your school community, please hit like, subscribe to this channel, and head on over to mcgill.com to join our email list, browse essential school nursing supplies, and read informative blog posts. Thanks for watching.